In this short video, I'm going to show you how to properly tissue bank a prostate. First thing you do is you get out your prostate. Introduce yourself to the prostate. Hello, prostate. How are you? So the orientation of the prostate is the most difficult part of the prostate. Everything else is pretty easy. So this prostate here, you can see, is a little bit smaller than average, but it's still a good example of how to orient it. Okay? So what we have coming off the posterior base of the prostate are the vas and seminal vesicles. In my right thumb is the right vas, right seminal vesicle. My left thumb, my left vas, left seminal vesicle. This area of cautery here is where they remove the bladder. So this is the base of the prostate. Opposite of the base is the apex of the prostate. Okay? We take a probe, we put it through the prostatic urethra. You'll see this is the anterior, the posterior, the right, and the left. So we have our orientation down. Okay, so now what we want to do is we want to cut through the posterior aspect of the prostate. Not all the way through. We want to section it and butterfly it open to check and see if how much tumor is there and is there any tumor we can take for tissue banking. So, looking at this prostate, there's a lot of lumps and bumps, BPH looking things. There's a little bit of yellow granulation here. Do you see this here? It's pretty poorly demarcated. It's not real clean, but this is going to be my best area for possibly finding tumor. You see, contrarily, over here it's a little bit more pink and fleshy. And we like to take it from the peripheral zones rather than the transitional zones. There's more likely tumor on the periphery. So, taking your knife, very delicately, don't go to the outside because we're going to need to assess that margin later. Starting on the inside, just shave off what you feel is the best site of tumor. And set it aside. Clean your blades and your forceps, and then we'll do the same thing for the normal. This side looks to be the most normal. Take a shave of it. And place it down. Okay? With our normal and tumor there, we'll divide those into 4 equal pieces. And then we'll place them in the pre-labeled tubes. You'll notice this one's labeled prostate normal 1, PN1, and then we'll have prostate normal 2 in a cassette, prostate normal 3 in another tube, and prostate normal 4 in another cassette. So I take the number 1 tube, I put the first piece in the number 1 tube, and then the second piece in the 2 cassette, and so on. The tubes go in liquid nitrogen and the cassettes go in formalin for overnight processing. So we'll take our tumor section and do the same thing, cutting into 4 pieces and then placing those 4 pieces consecutively in the cassettes, labeled PT1, PT2, PT3, and PT4. Prostate, tumor, and then whichever piece it is. And these tubes also go in liquid nitrogen, and cassettes go in formalin for regular processing. So we're almost done. The only other thing we need to do is remove the tops of the seminal vesicles. Okay, remember how the vas and seminal vesicles were coming off? We're just going to take the little bit of the seminal vesicles off the top, both right and left. And then we put it in the tube labeled prostate seminal vesicle. Alright, so there's our 5 frozen samples, and we had our 4 cassette samples already. So now what we'll do is we'll dry off the cut surface of the prostate as best we can. We'll take some super glue and we'll apply super glue to 1/2 of the prostate, focusing on the periphery to get a good seal. And then we will glue the prostate back together so that we can properly gross it tomorrow. And you see what I'm doing here is I'm taking this loose soft tissue that's on the outside and I'm kind of pinching it, trying to run it together, creating a seal, a good margin. And in a perfect world, you'll hardly be able to see where I made that cut after the super glue dries. Just work your way all the way around the whole cut. And we should be back to normal now. So that is how you tissue bank a prostate.